Hello, my name is Hannah Lang and I'm going to be comparing New Zealand and the United States healthcare systems. Both the United States and New Zealand benefit from a comprehensive healthcare system composed of both public and private sectors. In New Zealand, the government plays a fundamental role in providing for the population's healthcare needs. New Zealand offers both public and private coverage, but majority of New Zealand residents benefit from a public healthcare system. All permanent residents have total access to an assortment of services which are financed through taxes, making healthcare costs little to none. Residents have the opportunity to obtain private health insurance, although it is uncommon. Privately financed healthcare is used to cover elective surgeries or private outpatient specialist consultations. About 1/3 of the population has some form of private health insurance purchased by the individual. The United States has both public and private health coverage as well. Private coverage is more common, accounting for about 67% of U.S. citizens. This includes employer-provided insurance and individuals acquiring coverage directly. Public programs include Medicare, Medicaid, direct purchase, and military coverage. The next topic we are going to discuss is population health with a focus on life expectancy. In 2016, the World Bank reported the life expectancy rates for countries around the world. As of 2016, the overall life expectancy in the United States was 78.69. The male average was about 2 years younger at 76, and females were average at about 3 years older at 81.2. As seen in this graph, New Zealand's average overall life expectancy rate surpassed the United States in 1990 and has been advancing ever since. In 2016, New Zealand's overall life expectancy average was 81.6. Males were just below with an average of 79.9, and females were slightly above at 83.4. According to this report, in 2016, the average New Zealander seems to be living about 3 years longer than the average American. Next, we will be discussing total healthcare spending per capita of both countries. As we see on this slide, the Organization for Economic Cooperation and Development reported that in 2016, New Zealand's total healthcare spending per capita was $3,683 US compared to the United States at $10,209 US. This slide is interesting when comparing it to the previous slide on life expectancy. On this side, we see that New Zealand spends a little over 1/3 of what the United States spends on health per capita, yet as shown on the previous slide, their average citizen has almost a 3-year higher life expectancy. A large contributor to healthcare spending is emergency department visits. In 2017, the United States had almost 3 times as many emergency room visits at 43,300 visits per 100,000 people compared to New Zealand in 2016 with 15,000 visits per 100,000 visitors. Another contributor to rising healthcare costs is the population's health status. According to the Centers for Disease Control and Prevention, worldwide tobacco use causes more than 7 million deaths per year. If the pattern of smoking all over the globe does not change, more than 8 million people a year will die from diseases related to tobacco use by 2030. Both New Zealand and the U.S. created tobacco control programs in the late 1990s to combat this problem. These programs have successfully reduced the percentage of smokers in each country. New Zealand's well-established tobacco control program was created and implemented from 1985 to 1998. The goal of this program was to reduce smoking prevalence and essentially have New Zealand be a smoke-free country by 2025. The program limited tobacco advertising, halved the affordability of cigarettes, and reduced smoking exposure in work time by 39%. The program requested strong political support for quit campaigns, increased taxation, and elimination of display of tobacco on sale. The control effort sparked awareness, and by 2004, all licensed premises, including bars, restaurants, clubs, casinos, and workplaces, were smoke-free. Smoking rates continue to reduce since the start of the program, with only 16% of New Zealand adults currently smoking as of 2019. In the United States, in 1999, the Centers for Disease Control and Prevention created the National Tobacco Control Program to encourage national efforts to reduce tobacco-related diseases. The goal of the program is to eliminate exposure to secondhand smoke, promote quitting amongst all, prevent initiation amongst the youth, and eliminate tobacco-related disparities. Strategies include community interventions, counter-marketing, policies and regulation, as well as surveillance and evaluation. Since the creation of the program in 1999, the percentage of adult smokers has decreased from 23.5% to 14% in 2019. The next topic of discussion is the physical environment with a focus on air quality. Air Quality Index is the index for reporting daily air quality. It tells you how clean or polluted your air is and what associated health effects might be of concern for you. Air Quality Index runs on a scale from 0 to 500, with 0 being the best possible and 500 being extremely hazardous. The United States Environmental Protection Agency has divided AQI into 6 different categories, each assigned a specific color. This makes it easier to distinguish on the map. As you can see on the slide, the color green means good air quality and the color maroon means hazardous air quality. According to the World Air Quality Index project, most of the United States air quality falls within the 0 to 50 AQI range, also known as good air pollution. There is a decent amount of yellow throughout the U.S. map, which indicates moderate air quality. In a few areas, we are seeing orange and purple, indicating unhealthy for sensitive groups or very unhealthy air pollution levels at the center of the country and as well up towards New York. As you can see on the lower map, the majority of New Zealand's air quality index is located in the 0 to 50 range. The Auckland, New Zealand region in the north part of the country has moderate air pollution with a 59 AQI. This next slide touches on an issue that's very prominent in today's healthcare world, the unmet need for drug treatment. A quote stated from the Mental Health Commission's report, measuring mental health and addiction in New Zealand, states around 50,000 people, 1.9% of the population aged 16 to 64, wants help to reduce their alcohol or drug use every year but does not receive it. In response to this shocking statistic, New Zealand Drug Foundation stated that New Zealand's current criminal justice approach to drugs does not seem to be working. The prohibition and criminalization may be counterproductive to reducing harm from drugs. So New Zealand is now shifting their stance on drug treatment to try a more health-based approach. This approach includes decriminalizing the use and possession of all illicit drugs, but to keep their supply illegal, legalize the use and supply of cannabis, and boost harm reduction and treatment services as well as drug education. In the United States, the Substance and Abuse Mental Health Services Administration specified that in 2015, among 19.3 million people aged 12 or older who were classified as needing substance use treatment, only 4.6% of the population actually received that treatment. The overall health of the nation is improved by the extent to which the population actually has access to needed substance use treatment. Hence, the Substance Abuse and Mental Health Services Administration states that recovery is built on access to evidence-based clinical treatment and recovery support services. More specialty treatment facilities and programs provided will help meet these unfulfilled needs. Lastly, we will compare the teen birth rates per 100,000 women ages 15 and 19 years old between the two countries. In 2017, it was reported that the United States teen birth rate was 1,880 per 100,000 women, and the U.S. teen birth rate has declined more or less continuously over the past quarter century, and this is currently the lowest level ever recorded. In New Zealand, it was reported that as of 2016, the teen birth rate is 1,600 per 100,000 women. New Zealand's teen birth rate has dropped every year since 2008. In summary, majority of New Zealand's population relies on public coverage because of the heavy government subsidies. These subsidies make the system little to no cost, which is why New Zealand spends only $3,683 per capita. New Zealand has impressive healthcare statistics. This included an average of 3-year longer average life expectancy and a third of the emergency room visits compared to the United States. New Zealand also has done a great job at addressing and meeting the needs of those suffering from drug addiction and their tobacco control efforts. Overall, New Zealand's healthcare system seems to be striving and succeeding at protecting and meeting the needs of their people. On the other hand, the United States healthcare system is predominantly private coverage, including about 67% of the population. Compared to the rest of the world, the United States has a way higher healthcare spending capita at $10,209. The U.S. is performing well in life expectancy, tobacco control, and teenage pregnancy rates, but could improve in other categories such as emergency room visits, drug treatment, and healthcare spending. Thanks for watching.